Is poor posture the most common cause of back pain? Many patients believe that poor posture is the main cause of back pain, often blaming slouching or improper sitting habits. However, research suggests that posture is not a common cause of back pain. Let's see some research evidence about posture. 1. Studies fail to demonstrate a strong link between sitting or standing posture and chronic spinal pain. While many patients experience pain in certain postures or during specific movements, including lifting objects, they are not the cause of the pain. Rather, it seems that for some people, existing pain can be aggravated by specific postures or movements, and that reducing these can be helpful. However, there is no value in trying to prevent back or neck pain through rigid advice on correct postures or movements. Discomfort is more likely influenced by a combination of intrinsic factors, including muscle fatigue, and extrinsic factors such as time spent in a given position. 2. Staying in one position is often problematic for patients with existing neck or back pain. This is unlikely related to the posture itself and more likely due to changes within the patient, such as increased sensitivity. Rather than aiming for a perfect posture, which can unhelpfully exacerbate hypervigilance, regular movement and breaks are key to maintaining musculoskeletal health. For office workers or others with prolonged periods of sitting during the day, simple strength training every other day has been proven to be helpful in reducing pain. And 3. Other factors such as stress, sleep quality, and overall physical activity levels play a significant role in spinal pain. Poor sleep is linked to increased sensitivity and slower recovery, and inactivity may lead to reduced stamina. Perceived job satisfaction, pain control, and pain's influence on work tasks are other important factors that affect how much pain impacts on the patient's life and workability. Addressing relevant factors with your patients can improve pain management and their overall well-being. How can these messages be integrated in clinical practice? 1. Help patients understand that posture is not a risk factor for neck or back pain, and therefore that attention to posture is only relevant if it helps the patient understand and control their pain. Even if a patient has recurrent pain, they do not need to pay special attention to posture during pain-free periods. 2. For patients with current neck or back pain, changing posture frequently can be helpful and should always be accompanied with advice to engage in regular movement, preferably including a routine with strength training. 3. Address your patient's concerns about posture and provide them with knowledge and support to make them feel safe and interested in experimenting with different postures that either give them pain relief or helps them experience that pain and posture are not causally linked. 4. Shift the focus from achieving perfect posture to building strength and resilience, which play a greater role in preventing discomfort. And 5. Promote a holistic approach by addressing sleep, stress, and physical activity for better pain management. Let's put it in practice. Sarah, a 35-year-old office worker, believes her back pain is caused by poor posture at work. She says she always tries to sit up straight and avoids certain movements in fear of aggravating her pain.
Sarah, I understand why you're concerned about your posture. Can I tell you what we now know about back pain?
Yes, please. Even though I try to sit up straight, my pain doesn't go away because I slouch a lot without realizing it.
It's great that you're paying attention to your body, but there is little evidence that posture alone causes pain. What matters more is how often you move throughout the day. In other words, the best posture is the ones that make you feel comfortable. So if you feel discomfort in one position, just move to the next comfortable one.
So sitting slouched isn't bad for my back?
No. There's nothing in the evidence that suggests that sitting causes pain or pathological changes to your body. But inactivity is not ideal for anyone. So, think about implementing movement into your daily routines. A bit of strength training every other day is also likely to do you good and maybe even reduce your pain. So let's focus on movement and staying active to make your back feel better.
To sum up, as healthcare professionals, we must help patients move beyond the misconception that poor posture is the main cause of back pain. We can shift the focus from perfect straight posture to movement, resilience, and overall well-being, helping patients reduce their concern about posture and promoting comfort in sitting.